Good evening, everyone. Today is Friday, the 26th of March. My name is KT Gallagher, and I'm the Dunn County Health Department Director, here to give a COVID update from a Dunn County perspective. Thank you guys for the questions that you submitted through direct message. We had 5 today. Also, thank you for your patience. Really excited to say that I was filling in the clinic today, and so we were able to get about 230 shots into educators, second shots into educators this week, 150 of those today. So always exciting to see the immunity go up in the community. So with that, start with our numbers. In Wisconsin, we have had 2.7 million people test negative for COVID-19. That's an increase of about 4,000 over yesterday. So seeing some of our testing numbers go up a little bit. I'd like to see it a little bit higher, but it's good for now. We have had an increase of 434 cases of COVID over yesterday for a total of 574,840 people testing positive for COVID-19 in Wisconsin. And finally, we have had 6,597 Wisconsinites lose their life to COVID-19. And if you're following the data day to day, you'll know that that's a reduction over yesterday. We actually had 4 additional people die, but because of the data cleaning that the state is continuously doing, making sure that records match from the local departments, that there is a reduction in 2 over yesterday. So in Dunn County, we have had 18,772 people test negative for COVID-19. We've had 4,355 people test positive. That's an increase of quite a bit over yesterday. So we had a fairly large case load yesterday. I'm grateful that it was back down to that 3 to 5 cases a day that we've been seeing the last couple of weeks, but we definitely have seen some peaks in the last week following spring break. We're holding steady. So we've had an increase, like we've had an increase in cases, we've had an increase in active cases. So we're following 44 active cases currently. 2 of those folks are hospitalized. 1 has been hospitalized for quite a while. And then we have 30 deaths, holding steady at 30 deaths here in Dunn County. Talking about vaccinations, we have delivered over 2.5 million doses to Wisconsinites. Of that, 948,765 people have completed the series. So they've gotten 2 doses if it's Moderna or Pfizer, or 1 dose if it is a Johnson & Johnson vaccine. So that represents 16.3% of Wisconsinites have completed their series. In Dunn County, we have had 16,174 doses delivered to Dunn County residents. We have had 6,131 Dunn County residents complete their series, and that's about 13.5%. So definitely room for improvement, but we are picking up steam and getting more folks vaccinated, and that's good. That's really good. It's our pathway to normal-ish. All right, so we have 5 questions. First question was, for those that are COVID positive, are you tracking or asking if they've received the COVID shots? Thank you for this question. This is actually something that we ask when we do contact tracing, is if they've been vaccinated. We actually pull in their WIR record, which is the Wisconsin Immunization Registry, because state agencies are really creative with acronyms, but WIR. And so it talks to WEDS, the Wisconsin Electronic Disease Surveillance System, and we pull those records in because we want to know if we've had any vaccine breakthrough. I can't pull a report right now, and so I don't manually go through those to see what kind of data we have, but we have seen a couple. Typically, we're seeing people that were either exposed before they got their shot and got sick after their shot, or folks that hadn't completed the series and still had, it's not considered breakthrough at that point, but they hadn't completed the series. Every now and again, we are getting positives. I think I've seen 2, maybe 3 positives for surveillance. And so in our long-term care facilities, we're continuing to test regularly because of the community level of infection and percent positivity in the tests that we're having done here. And so every now and again, we are finding asymptomatic, and I'm grateful for that, asymptomatic PCR positive individuals. And so we have had a little bit of breakthrough, but you'd expect that. So 95% efficacy, that still means 1 in 20 folks that are vaccinated could get infected. But what we're seeing is they're not symptomatic. And so that says to me, it's still, the vaccine is still working at a very high level, and it's making it so that that person is not sick in an outward way and definitely wouldn't be hospitalized. So it's doing its job. The question we're still trying to answer is, if you test PCR positive after you're vaccinated, are you able to get other people sick? And that's something we're still trying to understand. All right, next question. How many residents have tested positive twice for COVID? So we track reinfections. We have had 23 Dunn County residents test positive twice, more than 90 days apart. And so people can shed virus on and off at low levels for up to 3 months after they feel better. So we really recommend folks that if they're not symptomatic, don't test within 3 months. If they are symptomatic, we want to test, we want to see what's going on. But for asymptomatic folks, wait that 3 months. What we're finding is in the 23 people that have tested positive, we have a mixture. We have a mixture of people that were tested after 90 days for surveillance, like they work in a long-term care facility, or they want to travel and are asymptomatic. And some of those have had close contacts with other known positives. So it's still very much likely an infection, and we follow up on those disease investigations just like we would a first infection with contact tracing and quarantine. Because again, if they can test positive, and the preliminary data says that with reinfection, the viral load isn't so much septic, or that's not the right word, it's not in your body the same way, but there's a higher concentration in the nose. So, you know, again, people coughing, sneezing, talking, we still think that you can pass that from a reinfection to other people, especially if we're dealing with different variants. Yeah, so 23. Number 3, can you share a bit about how people are currently catching COVID? What behaviors are we seeing that are resulting in transmission? Not that they expect that it's changed much, but it's a good reminder. So we are seeing people relax what they're doing. So we have a cluster of cases that we're working right now that's associated with a family gathering that involved a couple different locations, a gathering of 75 people. So gathering in large groups. Another thing we're really seeing is travel-related infections. So we had 5 yesterday related to travel to a nice, warm, sunny state that's known for its high transmission rates and its high level of variants. And they've imported that back into Dunn County. Travel remains a risk factor for COVID-19 infection. We're seeing it in our cases. You can't control for all the variables of how you go about your day and how close you are to others if you're going to places like Daytona. And then again, you know, the things, getting together in groups, high risk sports, traveling with other folks in confined spaces, we're seeing that when we do contact tracing. So again, keep your distance. Don't travel unless it's necessary. Stay home when you're sick. If you do travel, really consider staying home for 14 days. CDC guidance on traveling hasn't changed for immunized people. And if immunized people take their children, those kiddos aren't immunized and are still very at risk for infection. So after travel, CDC recommends that you test 14 days after travel to make sure you haven't brought anything home. For the love of all good things, If you're symptomatic after travel, don't dismiss it as anything like allergies or just a cold. Go get tested. If you have runny nose, sore throat, anything like that, don't dismiss it after travel. We're seeing a lot of imported cases, and those can spark outbreaks. Do your part, go get tested, especially after you travel. All right, next question. Are you seeing or concerned about potential for an uptick in cases due to spring break related travel? Yes, yes, and yes. And I get it. I know you're tired. I'm tired. I would really like some more sunshine in my life, but there remains a risk in traveling, even if you're really careful. So we've seen it in school districts that had earlier spring breaks. We have a couple school districts that are yet to go on spring break. I hope that the uptick in cases that we're seeing right now is a speed bump and not a spike. Do your part. If you do travel, work from home, study from home, 14 days, get tested if you have any symptoms. Don't go to school sick or work sick. All right, last question. How, if at all, do you see revised CDC guidelines for schools changing your recommendation for Dunn County schools? What is your opinion of the new reduced distance requirement, especially considering that this guideline was based on were from a time where the more infectious UK variant, B117, was not yet present in any significant degree? So that's a great question. So while the CDC has put out a guidance for reduced spacing, you'll remember that we started that way back in September, looking to cohort groups, space as much as we can, but with low community transmission. The idea is that the risk, there is some protection in 3 feet, there's more protection in 6 feet, but the risk is low enough that we can bring kids back in cohorted. So I don't think that anything's going to change, because what hasn't changed from the CDC's perspective is what is a close contact. And a close contact is somebody that's within 6 feet of somebody who tests positive for COVID for more than 15 minutes cumulatively over a 24-hour period. And so if we've got kiddos that are in a classroom and they're at 3 feet, we are going to see more quarantine. So more kids would be impacted with quarantine, but we'll still be able to prevent that transmission. That's my hope. But as our cases go up in the CDC's guidance, they have kind of a community risk, and they have that in a couple, 3 colors. And they take into consideration percent positivity and the activity rate. So how many cases you're averaging on the last 7 days. And they give kind of a rating. Right now, Dunn County is in their orange rating. So there is not the highest risk, but there's a significant risk. And that's based on our 7-day activity rate. When they are not aligned, we default to that higher risk level. If our cases go up substantially, we'll be in their significant risk, or their highest risk level. And I'm blanking on the word, I'm sorry, I should probably pull it up so you guys can see it. And that does reinforce the need to space more and be more aggressive. In our schools, and you guys have heard me talk about this before, they have a multi-layered approach. Our schools are doing an amazing job with hand hygiene, symptom monitoring, environmental cleaning, and then policies about restrictions. And so we don't see that same thing in friend groups or in other employers necessarily. And so that multi-layered approach gives us some comfort on relaxing physical distance. It doesn't relax the need to quarantine if you're close to somebody. And we saw that last September. But as the CDC goes and as the state goes, we will toe that line, working with our our school districts to find something that balances the risk of COVID and the harm of not being in person, access to food for many of our food insecure folks, access to a safe place to learn. It's hard to learn when you've got several siblings sitting there or you don't have access to broadband. There are barriers in our community for folks that are trying to learn remotely, children that are trying to learn remotely. And I've said it before, there's no perfect answer. It's really that balance. And so we're trying to split the middle. I did want to show one quick thing, and I thought I read it in here, but I must have just been scanning about variants. And the Wisconsin DHS has updated their website again to talk a little bit about variants. And so I'm going to share my screen just for a second.